talk with someone, you have to be able to communicate with them. Most Alzheimer patients develop communication problems in the middle or latter stages of the disease. Effective communication requires that the person be able to hear, see, and understand the meaning of words being spoken to them. As we're listening to someone, we interpret not only the meaning of their words, but also the emotions in their voice and their body language as they're talking to us. Today we're going to understand the difference between speaking and understanding, as well as the importance of good sensory function in the Alzheimer patient. But to begin with, let's talk about how the brain communicates.
Your brain has two areas that control communication. The part that controls speaking is located in the frontal lobe, and the part that controls understanding is located in the temporal lobe. Some people with dementia can speak but not understand, while others can understand but not speak. In advanced stages of dementia, some people can neither speak nor understand. This can be very frustrating for residents as well as caregivers. Communication problems are common in residents with mid-stage dementia and may produce symptoms that resemble stubbornness or meanness. Remember, a resident who may appear to be ignoring you is just having trouble understanding you, and a resident who seems to be refusing to speak to you is just having difficulty forming the words. Problems with speaking and understanding are common in demented residents. These problems are the result of brain damage, not stubbornness or meanness. Additionally, cursing is not controlled by the same part of the brain that enables you to speak clearly. Some residents may curse even though they are unable to speak. Do not be offended by their cursing. Demented residents who curse cannot control their actions because they have brain damage. When communicating with demented residents, it is important to use both verbal and nonverbal cues. Messages are not only sent by words, but also by tone of voice, by facial expression, and by body language.
Sometimes a patient seems like they understand more than they actually do. A simple way to check understanding is to ask the patient to repeat a simple story. We'd like to test your hearing. I'm going to tell you a short story, and I'd like you to tell it back to me in your own words. Two men get in a car and drive to the store. They buy a bottle of milk for breakfast. Now, can you tell me that story back in your own words?
Went to the store and bought 2 bottles of milk, and so I don't know what done happened to my milk.
That's fine, that's fine. Thank you. Let's look at the parts of the brain involved with communication. The part of your brain where you do talking is located right here in the frontal lobe. It's right next to your eyebrow. The part of your brain that does your hearing and your understanding is located right here in the temporal lobe. That's located right next to your ear. In the bigger model, we see the frontal lobe up here, which does your talking right in this region, as opposed to the temporal lobe right here that does your hearing and your understanding. Let's see what these brain regions look like in a person with Alzheimer's disease. Right here we have half a brain from a normal individual, and then we have a half a brain from a person with Alzheimer's disease. Notice the shrinkage of the brain tissue in the Alzheimer patient versus the normal individual. Now this is the part of your brain right here that does your talking, and this is the part of your brain that does your hearing and understanding. Look at the shrinkage in the part of your brain that does your talking in Alzheimer's, and even more so, look at the shrinkage in the temporal lobe right here, which is the part of the brain that does the understanding. Now, if you cut a section right through the middle right here, this is what you would see. This is a section from a normal person, in early dementia, and in end-stage dementia. Now look at the volume of the temporal lobe right here from the normal versus the mid-stage versus the end stage. This brain is so shrunken that this Alzheimer patient would almost certainly have difficulty understanding spoken word.
I think eye contact is important. Sometimes gestures help because a lot of times they might see but don't hear correctly. They're hard of hearing. So those things are important. Well, I'd repeat the question, and if that's not clear, then I will gesture or do it myself. I'll act it out myself.
You can improve communication with demented residents by following 2 simple steps. 1. Make sure residents' senses are as sharp as possible. Always make sure residents are wearing their glasses and their hearing aids. Try to talk to residents in a quiet, calm environment. It will be easier for them to hear you and to concentrate on what you are saying. 2. When speaking with residents, remember the 4 S's: simple, slow, show, and smile. Simple. Use simple one-step commands and simple words. Slow. Speak slowly. Show. Whenever possible, point out an example or demonstrate instructions to residents so they benefit from your words and your actions. Smile. A smile sends a powerful message of reassurance to residents. Communication can be easy with demented residents if you use simple words, slow down, show them what you are saying, and smile a lot. Try to imagine what it would be like to have trouble understanding other people, like someone who has dementia. You find yourself on an unfamiliar street in your town, and you realize that you can't find your way home. You stop someone on the street to ask for directions. A person who has mild dementia may have trouble understanding approximately every 4th word that is spoken.
At the next shingo, turn left, go massugu, then you turn migi at the pink tatemono, and it will be on your hidarigawa.
A person who has moderate dementia may only understand every other word.
No. At the next shingo, turn hidari, go massugu, and at the pink tatemono, turn migi, and it will be on your hidarigawa.
I don't understand.
A person who suffers from severe dementia may barely understand anything that is spoken.
次の信号で左に曲がって go straight at the pink 建物右に曲がってまっすぐ行って左側にあります。
Communication problems can be aggravated by bad vision and by bad hearing if demented residents are not wearing their glasses or hearing aids.
No. 次の信号を曲がってまっすぐ行ってこの建物で右に行って左側にあります。
Demented residents can feel lost and confused every day. They may not understand your directions, and they are afraid that they will never find the way home. Imagine how you would feel if you had trouble understanding everything people said to you. There's more to communication than simply the words that are being said. How you say things, your nonverbal communication, also tells a person a lot.
今日雨降りそうね。
Would you say this woman is happy, sad, or angry?
今日雨降りそうね。
How about now? Is this woman happy, sad, or angry?
今日雨降りそうね。
And how about now? Which woman do you like better? Who are you going to trust? Even though you don't understand what the Japanese woman is saying, you can still tell if she is happy, sad, or angry. Even though demented residents can't always understand what you say to them, they do know when you're being nice to them. That's why it's very important to smile, make eye contact, give a reassuring touch, and listen to residents. Let them know you are there to help. Please stop the tape and discuss ways you can improve your communication with demented residents.
Miss Parker has Alzheimer's disease. She is very nice and agreeable unless you ask her to do something like use the toilet. Sometimes she even becomes hostile. What can you do to help Miss Parker?
Give her medication to calm her down.
Ask Miss Parker to explain your instructions back to you. That way you'll know if she understands what you're asking her to do.
Ask her family to take her home. She's unmanageable.
Miss Parker wants to be incontinent. She needs adult diapers.
Mr. Anderson has dementia. He often has trouble speaking to you. When he is angry, he can curse with perfect speech. What is the best explanation for Mr. Anderson's strange behavior?
He avoids speaking on purpose because he doesn't like living in the assisted living facility.
Mr. Anderson chooses not to speak because he is stubborn and mean.
The part of his brain that speaks is damaged. The part of his brain that curses is not damaged. He cannot control his behavior.
Mr. Anderson is trying to get back at you because he doesn't like your attitude.
What can you do to help Mr. Anderson?
Ask his pastor to pray with him about his cursing.
Tell Mr. Anderson's family about his bad habits.
Scold him and tell him he may not speak to you that way.
Ignore Mr. Anderson cursing. He is unable to control his language.
Ms. Hastings suffers from dementia. She resists you during bathing. You explain the procedure to her and she seems to understand. She can even repeat some of your words. What should you assume?
Repeating words does not mean that Ms. Hastings understands them. You should ask her to fully explain the instructions back to you. Then you'll know if she understands what you're saying.
Miss Hastings understands everything. She can repeat words back to you.
If Miss Hastings can hear you, she can understand you.
She speaks fine. She should be able to understand.
Ms. Palmer has Alzheimer's disease. She often fails to follow your instructions. She smiles and acts as though she understands, but then does the exact opposite. What can you do to help Ms. Palmer?
Speak to her loudly with a sharp tone of voice to get her attention.
Speak in slow, simple statements. Use gestures and repeat your instructions several times to make sure Miss Palmer understands you.
Give her written instructions. She'll understand those.
Call Ms. Palmer's family and tell them to scold her for her childish behavior.